Okay, we're on again with Shomik Sengupta. Had a successful launch to the USANZ meeting, and can believe it, we're more than halfway there with one more day to go. Shomik, tell a little bit about the breakout sessions that USANZ does after the plenaries.
Yeah, so usually the afternoons are devoted to a few breakout sessions which are thematically arranged. There's still a fair bit of oncology that takes place. We had a nice multidisciplinary oncology session where we heard a bit about castration-resistant prostate cancer from Maria Rabal. That's a fast-moving and exciting area. A number of other talks in that session about clinical trials and translational research. We had a renal oncology session where we heard about retroperitoneal sarcomas and upper tract urothelial cancers, relatively rare diseases that we all sort of grapple with from time to time. We had benign disease, talking about functional urology challenges, what to do in the post-mesh era, how to manage overactive bladder using medical therapies, etc. BPH got an airing, looking at some of the new technologies like the UroLift. Some updated results were presented. And stone disease, there was plenty of discussion around the optimal way of managing various stone scenarios.
Anything you're going to take back to practice already?
Look, I think I learned a bit about sarcoma management. It's something that we need to manage in a team rather than individually. So that's probably the main thing that sticks in my mind from yesterday afternoon. We finished the day off with a few panel discussions, and there was a bit sort of talking about small renal masses. Again, they show up all the time in our practice, and there are a few dilemmas in the diagnostic process and what management algorithm to follow. There was, I guess, a somewhat political argument around how to manage the acute scrotum. I think sometimes the patient can get lost in the arguments about who gets in to manage it in the middle of the night, so we're trying to get things sorted so that we get best outcomes.
Now, as a first-time attendee, as international faculty, I must point out that this meeting has got the right size that the plenaries can be interactive, including with the app or mics. So talk a little bit about the discussions at the plenary.
Yes, look, we've seen that as being a very important part of the meeting, getting the most out of the guests. It's very easy for someone to give a talk and move on, but often the audience is left with a few questions, something to take it into relevance for their practice, perhaps a challenge that they've seen the previous week. So we've allocated time, and as you say, the meeting is of a size, people feel comfortable. The app sometimes helps people out because they don't have to get up and go to the mic and feel very self-conscious. So all of those things have facilitated the discussions. I think so far that's worked quite well. Talking to the guests, I think that's been well received, that they're happy to interact, and most of them have obliged and enjoyed the process.
Yeah, it seems like the moderators have figured out how to make it work and interject that.
It needs chairs to make it work, and also keeping to time, because I think it's too easy for the talks to take over that time. So we've tried to keep fairly strictly to time so that we do have the discussion time, which I think is the most rewarding part of interacting.
Yeah, other meetings have done it with Twitter and hashtags, but I think the app is it's more direct.
It's a bit more controlled, I think.
Correct. How about today? We have plenary moving on to some of the next to be the BJOI session.
Correct, yeah. So the morning plenary was on challenges in urology. We touched on a few things that are perhaps thorny issues or rarer issues. We heard about penile cancer from an Indian colleague. They see a lot more of it than we do in the West. We heard a bit about credentialing and high-risk prostate cancer. None of the treatment modalities have perfect results, so how do we improve that? What sort of additional treatments we might incorporate? So those were good talks. The second half of the plenary was focused on optimising patient outcomes with perioperative management, and those are again issues we deal with every day: anticoagulants, cardiorespiratory management, all of those sort of issues. So it was good.
When was your first USANZ meeting, if you can remember it?
My first USANZ meeting would have been when I was a trainee. Actually, even before I was a trainee, I presented a research project back in '98, I think it would have been. I was a junior sort of resident at that time. Then I started my training, and so in the late '90s, early 2000s, it was a bit of a different feel to the meeting. It was smaller. We certainly didn't have the sort of lineup of international guests to the same extent as we do now. The level of science, etc., was not quite where it is right now. It was a different feel of a meeting, a bit more of a laid-back social feel. I think we've tried to sort of continue to retain that friendliness and social interaction while building on the science further as the years have gone on.
All right, well, we'll report back at the gala dinner and another big day of science tomorrow.
Looking forward to the rest.
All right.